Daytime, everybody. Each and every month here we speak with Rob Wilson, who's from the Ottawa Paramedics, and he talks to us about various medical emergencies that one can have in the home and how to treat them. So today, Rob, what are we talking about?
Today we're going to deal with anaphylaxis.
Hey, come again?
Anaphylaxis.
Which is?
It's a, what anaphylaxis is, it's a severe allergic reaction by the body to a substance that's been introduced into it. The way it's introduced is through injection, absorption, inhalation, and drinking it would be another example.
So with spring, summer here, is it more common during this time of year?
Well, yeah, because of all the increase in the amount of insects. That's when everybody says, "Oh, you're allergic to bees," and that's
right.
That's where we see an increase, and that's always good to get the information out there about what to do when it happens.
Mm-hmm. Is it fatal?
It can be. What happens is that the body gets the substance introduced. So people that are allergic to stuff they're allergic to, like the nuts, the bees, medication is another one, dairy products, shellfish. So they ingest this stuff, and the body reacts so fast. Normally, when we, like, say, a mosquito bite, if you get bit, you have a little localized reaction. But what happens when you get a bee sting or you inject these substances is the body reacts severely. So it sends all the immune response to try to get rid of this substance, and it can happen, like, instantly.
Really?
So
yeah.
People that suffer from these sorts of things, do they wear a bracelet, that sort of thing, to let us know? That
Most people do. Some people nowadays don't. Just it's cost-wise for medical alerts, but it will save your life. Mm-hmm. And other times, somebody, like, say, Derek, if you had gotten stung by a bee before and you had a mild or a moderate reaction, the next time you get stung, you may not think you're allergic. You could have a severe one. So
okay.
it always, if you have like a localized reaction that you would consider to be more than a normal one would be, you should go to your doctor and get tested for allergies.
Well, let's stay on the bee sting.
Okay.
If we get stung, what should we be looking for as far as the signs and symptoms that something's different here?
Okay, so an initial, like a basic one would be just get the swelling and get the pain. But if you're really severely allergic, the stuff gets injected, the venom. And the body starts thinning out. So you'll start to get swelling, generalized swelling of the body. Of the throat is very, very dangerous. Difficulty breathing. They'll get hives and a red appearance to their skin. They may have wheezes when they're breathing. They'll get cramping, diarrhea, nausea, vomiting, elevated heart rate. So they begin to look sick.
Mm-hmm.
Right.
And how quickly do the symptoms show up?
Within minutes.
Okay.
If you have had a reaction in the past, it's usually within minutes. But if you're more moderately prone, then it will be slower. But with the peanuts or the bee sting, it happens pretty quick.
And what about the other examples, like, say, dairy or shellfish or something like
Shellfish
that?
can happen fast as well. Dairy and the medications are usually slower, but you gotta make sure, because you can have, even if a person has had a mild reaction before, they can, again, like I said, you got to stress over and over that they can have a severe reaction.
Okay, see, that's news to me. I thought that it would be, initially the first bee sting, okay, right away that you're allergic, but you're saying that's not the case.
No, let's say you disturb a bee's nest and you get stung multiple times, you may become more susceptible to the sting the next time.
Okay. So what do we need to do?
Yeah, exactly.
Okay, so the primary thing right off the bat, 911.
Mm-hmm.
Right.
You want to get the paramedics going, you got to get us there, because we have the treatment stuff to deal with the emergency when it happens. The next thing you want to do is you want to position the person comfortably, and you want to help them with their medication if they have it.
Okay.
This is called an EpiPen. This is a trainer. We'll get Melanie to demonstrate on Derek if we can.
Don't rub your hands together. There's no needle in this one. It's a trainer one.
Oh.
So we always want, if you're going
to
assist them with the medication, you want to make sure there's a couple R's that you do. There are 5 R's.
Okay.
It's the right medication, the right person, so it's prescribed to them, the right time, it's not expired, the right route, and the right period. So this is when you're going to give it to them and they're having an allergic reaction. So what you do, Melanie, is you pull the cap off. That's the primer cap.
Okay.
Put your thumb over top, and you just go for the muscular area in the leg, and you'll jab it in.
That'll be easy to find, Mel. Just plug it into my muscular area.
No, I'm just kidding. I saw that on Prison Break.
And you got to make sure you wear gloves all the time, wearing gloves, because if you do get some epinephrine on your skin, that's what that is. It's adrenaline. You'll absorb it, and it'll have an effect on you as well. So always wear your gloves.
What kind of effect?
It'll increase your heart rate. It won't make you black out like like nitroglycerin, but it will make your heart rate go up and make you feel a little jittery, like a caffeine rush.
That's the last thing we need.
Yeah.
Melanie and I think we're jittery and hyper enough.
So do I just go...
Yeah, you just take it and you jab down, and you heard the pop.
Yeah.
Then you'll hold it there for about 10 seconds, and that's just to make sure that the medication's gone in. Then you pull it out and you massage the muscle, and what that does is it speeds up absorption.
You like that, Derek?
Yeah, that's good.
That's the best way that it's done right now, but some older people will carry what's called an anakit. This is the older one that everybody sees. There's 2 doses of epinephrine with this, and they have a little tourniquet and actual chewable Benadryl. The problem with this is you got to get the tourniquet on, you got to find the right area and inject it in.
Okay.
But those are still around, is what
Yes,
you're
they're
saying.
still around.
Okay.
And you always got to stress as paramedics that when you have given the medication, make sure you keep the EpiPen and give it to us, because we have to know when it was given, and we have to check to make sure it was given properly. It's pretty foolproof for this nowadays, but sometimes there could be a misfire. And make sure you never put your finger over the end that's the injectable part, because there's a long needle and it will go right through your thumb.
Okay, 30 seconds left. Quick question. You mentioned all those things you have to look for as far as the medication.
Yeah.
Will that be right
It'll
on
be
it?
right on it.
So it'll be labeled like any other medication?
It'll be labeled like any other medication.
And for adults, it's blue. For kids, the pen is yellow.
Yellow.
Great. Now, next week actually is EMS week for the entire
right.
week next week, so stay tuned for that, because we're going to have tidbits each and every day here on Daytime about how to be safe. Coming up after the break, we're revving it up. Yes, if I can get it out, rev up the red.
The red.
Rev it. We'll be right back.
Red alert here in Ottawa. Great job.
Excellent.